Module 4. Script. Training on specific areas of service. Welcome to Module 4. In this module, we break down each major service line that healthcare coordination associates work with. The purpose is simple. Understand what each service is, what your responsibilities are, and how each one creates revenue. No fluff. No confusion. Section 4.1. Hospice Marketing and Business Development. Hospice is one of the strongest revenue sources for Bwell and Glen Valley Hospice. As an HCA, you must understand how to identify hospice-appropriate patients and build strong referral relationships with facilities. Hospice is comfort-focused care designed for patients with life-limiting conditions. It is medical care. It is covered by insurance. And it is not giving up. Hospice supports the patient and their family during the end-of-life phase with dignity and quality of life. Your responsibilities in hospice include building relationships with nursing homes, senior living communities, home health agencies, and hospitals. You will identify the key staff members who influence referrals, such as directors of nursing, social workers, and discharge planners. You will educate facilities on Glen Valley Hospice's capabilities and secure appropriate hospice referrals. You will also coordinate communication between the facility and the hospice clinical team, and work with the emergency vehicle division when patients require transport. Hospice referrals and transport services generate commissions for the HCA, making this one of the most valuable divisions to master. Section 4.2. Transitional Care. Transitional care focuses on patients who recently left the hospital, rehab, or skilled nursing and need structured follow-up support. As an HCA, your role is to identify recently discharged or chronically ill patients during screenings or facility visits. You will explain our transitional care services and assist with enrollment into value-based care programs. These programs include chronic care management, remote patient monitoring, and annual wellness visits. Your tasks include gathering patient contact and insurance information, scheduling telehealth onboarding, and making sure patients understand the ongoing support they will receive. Transitional care directly generates monthly recurring revenue. HCAs earn commissions for each eligible patient they enroll. Section 4.3. Health screenings and recurring testing. Screenings are the heartbeat of the HCA role. Screenings feed every other service line. Hospice referrals, transitional care, insurance navigation, EMS referrals, and value-based care all begin with a screening. Screenings take place in 4 settings: community pop-ups, facility screenings such as senior homes and apartment communities, Bwell-hosted events, and care access research studies, which use a separate pay structure. Your responsibilities are to schedule and coordinate screenings weekly, secure recurring screening agreements with facilities, ensure labs receive complete patient information and consent forms, and maintain strong communication with facility staff. Screenings generate immediate revenue from lab testing and create the foundation for all long-term business. Section 4.4. Value-based care enrollment. Value-based care improves patient outcomes while creating predictable monthly revenue. The programs you will support include chronic care management for patients with multiple chronic conditions, remote patient monitoring for patients who need daily vitals tracking, and annual wellness visits for Medicare beneficiaries. Your responsibilities include identifying patients who qualify, collecting accurate demographics and insurance information, and educating them on the benefits. Consistent check-ins, disease monitoring, medication support, and easier access to a provider. These programs generate recurring revenue, and HCAs earn commissions for eligible enrollments. Section 4.5. Emergency Vehicle Services. Emergency medical transport is both a clinical necessity and a major revenue driver for Eclipse Ambulance Services. Your responsibilities are to identify patients who need non-emergency transport, such as wheelchair or stretcher services, build relationships with facilities that frequently request transport, educate partners on Eclipse's capabilities, and gather the required patient information for scheduling. HCAs earn referral commissions on EMS transports. Even more importantly, EMS partnerships help strengthen relationships across hospice, transitional care, and ongoing screenings. Section 4.6. Insurance navigation. Many patients at screenings lack insurance. Helping them gain coverage benefits the patient and opens the door for them to enter Bwell's long-term programs. Your responsibilities include identifying uninsured or underinsured patients, using the approved broker link to collect their information, explaining coverage options in simple terms, and ensuring correct submission for processing. Insurance enrollments pay commissions to the HCA and open revenue opportunities through CCM, RPM, AWVs, and follow-up visits. Summary of Module 4. Module 4 teaches HCAs what each service is, what role they play in it, and exactly how each category creates revenue. This understanding removes confusion and gives HCAs a clear roadmap for how to succeed in every area of service within Bwell Health Solutions.